Hi everyone, welcome back to our channel. And today I'm so excited for this episode because we're diving into a question that so many of you have asked. Can you have endometriosis and not even know it? Now, joining me today is Dr. Albert Jung. Now, Dr. Albert is a Brisbane-based gynaecologist and fertility specialist with a master's in reproductive medicine. Now, he has a special interest in endometriosis and infertility. He also holds public appointments at Mater Hospital and is actively participate in medical education. Now, today we are going to dive into how endometriosis goes undiagnosed and how it affects fertility and what steps can you take if you suspect you have endometriosis. Now, let's welcome Dr. Albert Jong.
Thank you so much. Very excited to be here.
Thank you so much for your time and joining our YouTube as a special guest. Now, Dr. John, let's dive in. So many of women only find out they have endometriosis when they struggle to conceive or when they start fertility treatments like IVF. That is certainly one thing that I observe in my nutrition practice. Can you share with us why is it so difficult to diagnose endometriosis?
Yeah, well, there's a couple of main issues here. One issue is that the symptoms of endometriosis can be so varied, right? So we'll talk about the main symptoms, which they might not always be there from the very beginning, and they gradually sort of present themselves, and it can be quite an insidious sort of onset to them. So when we're talking about your pain, your two main symptoms of pain and infertility, we may not know about infertility until we're in our mid-30s and actually trying to fall pregnant. There's not a great single test to do for infertility. Similarly, with pain, you get your painful periods, you get your bowel symptoms, you get your bladder symptoms, and you get your painful sex and those sort of things. And there's not a one size fits all for everybody with all these symptoms with endometriosis having those specific symptoms or vice versa. Now, the other issue with late diagnosis or slow to diagnosis, traditionally, really, it's all been based around laparoscopy. Yeah, so diagnosis of endometriosis based on laparoscopy is tricky because one, not everybody has access to laparoscopy. Often there's big costs involved with laparoscopies, and invariably there's risks because it's a big surgery. Now, having said that, this is a big area that we've undergone some really great development over the last 5+ 10 years or so, looking at lots of less invasive or non-invasive ways of testing for endometriosis. And we've looked at different biomarkers and blood tests, and none of them have really come to the forefront. But the thing that has really stepped up in the last little bit is ultrasound scan. So ultrasound scan diagnosis of endometriosis has really taken off. What I do want to highlight here is that ultrasound scanning is great for, when we see endometriosis on an ultrasound scan, we can be now pretty confident that there is going to be endometriosis there. Where we're still not quite as good there is when we've got that really superficial disease. Those types of endometriosis aren't always going to get picked up on an ultrasound scan. And the other thing that I would just want to highlight here is there's really not all ultrasound scans are the same. So it's really important to get a good quality ultrasound scan because the ultrasound scan and the operator that's doing the ultrasound scan is so much more important than for other forms of imaging, like an X-ray or an MRI or a CT, where you just sort of lie there and the machine sort of zooms and, forward and back. How you hold that probe, for example, is so important for the types of images that you get from ultrasound scan. Yeah.
Wow. I think we can all agree that it's not the one type of condition that can easily be diagnosed, right, from the doctors.
Absolutely.
So for women who suspect they have endometriosis symptoms, right, you did touch on like pelvic pain or experiencing pain while having sex, or is there other symptoms or any red flags that point people that, all right, maybe I should be seeing a GP as a first step, or at what point they should consult like fertility specialists like yourself?
Yeah, I think if at any point that you've got concerns, absolutely go see your GP. Yeah. But those are the symptoms that I talked about a little bit earlier. So things like period pain, things like urinary or bowel pain or dysfunction or pain with sex. So to dive into those a little bit more in detail, when we talk about period pain, The tricky part here is can be so subjective. So one person's period pain doesn't equal somebody else's period pain. But as a general rule, period pain that stops you from doing work, going to school, or you put your social life on hold, that's not normal. Yeah. Period pain that requires more than a little bit of paracetamol, a little bit of ibuprofen for a couple of days is not normal. And if you're having that sort of level or above of period pain, then absolutely you need to go see somebody. From a bladder bowel, yes, absolutely. When you pass urine, when you pass bowels, if it hurts, but also disturbances of like constipation, diarrhea, bloating, increased urinary frequency, recurrent UTIs, particularly if they are in conjunction with periods around time of ovulation, or you see a cyclical pattern. Again, those things are a reason for us to see somebody. Now, again, what's really tricky is we know that there's a big overlap between things like IBS or IBD with endometriosis, and a lot of those symptoms do overlap. And sometimes it is really tricky to go, hey, is this IBD or IBS, or is this endometriosis? And that's where sometimes a professional opinion might help. Yeah.
Yeah. Thanks for sharing that. Now we're going to shift the gear a little bit apart from the diagnosis. Let's jump into how does endometriosis can really impact fertility, Dr. Albert. So we all know that endometriosis can make conceptions more difficult, more challenging. Can you share with our audience why and how exactly does it affect fertility?
So the first thing I want to say here is there's so much about endometriosis that we still don't really completely understand, whether it's how we get endometriosis or how it progresses. But when it comes to fertility, we think it's mainly two reasons or two factors. So one is adhesion formation or altered anatomy, particularly of the tubes and ovaries. So if the ovaries or tubes are stuck to the sidewall or stuck to bowel, they might alter their function. And secondly, it's about inflammation. It's about inflammation that's caused by the endometriosis. Then that affects ultimately egg or embryo quality, because that's then exposed to the abdominal cavity when it's making its way from the ovary into the uterus there. So those are the two main mechanisms that most of us would agree on are how fertility is affected.
So if a woman diagnosed with endometriosis, what are the chances of getting pregnant naturally, or is there anything like in terms of treatment perspective, like what are the considered kind of factors for women's trying to conceive?
Yeah. So the first thing I would say here is keep in mind that endometriosis does not equal complete infertility. Endometriosis often is associated with infertility or subfertility. Now, we have tried to look at this we've tried to stage endometriosis to look at, hey, if you have minimal disease, does this mean you have minimal difficulty with fertility? And if you have terrible disease, does that mean you have terrible difficulty falling pregnant? And there doesn't seem to be very clear correlations between the two. Yeah. So keep that in mind. Broadly speaking, we have two options in terms of management of endometriosis when it comes to fertility. And the evidence is not very clear as a big, broad, this is what we should be doing for everybody as to what we should be doing. So those two things are A, surgery, specifically cutting out endometriosis, and two, it's IVF or ART, what we call assisted reproductive technologies. Again, there is no big, broad consensus that everybody should have this or everybody should have that. And it absolutely needs to be nuanced and individualized. So, for example, if you have superficial endometriosis and you have no pain and fertility is really your main issue here, probably okay to go down the IVF or the ART pathway. But if pain is a big component, you're probably better off down the surgery pathway to help with your pain and hopefully help with your fertility. Yeah. Similarly, it's things like, hey, where is your endometriosis? And how is that affecting things like access? So, for example, if you have a large endometrioma, 5-6 centimeter endometrioma, and not only is the endometrioma on your ovaries specifically, but is it impacting on access to those ovaries when it comes time for egg pickup? You're probably better off down surgery first, then plus minus IVF/ART. Yeah.
Yeah. So I think we can once again agree that every individual like different, like very unique fertility kind of condition. So that's where, always consult like, a fertility specialist to gain like personal advice. I think that's a very important thing rather than, we just look at online information, try to picture, the same thing. Yeah, sometimes can be like a
Absolutely.
lot of misconception around managing
Absolutely,
endometriosis.
absolutely. And I tell my women all the time that,
Yeah,
hey, these things might be true, but it might not necessarily apply to you. Yeah.
yeah,
So absolutely, it needs to be individualized.
yeah. Now, as you know, I'm a fertility dietitian. I am really passionate about educating women, adopting anti-inflammatory dietary eating as well as other lifestyle, right, to help to boost their fertility. So for endometriosis, I usually will share with women, try to implement a lot of anti-inflammatory eating strategies plus managing, try to lowering down the estrogen exposure as well naturally. I'm just curious, Dr. Albert, are there anything specifically as well, like in your practice, that you will encourage women to also adopt like lifestyle or holistic kind of approach to help managing or support endometriosis?
So it sounds so simple, but it's so hard, isn't it? Right. So
Mm,
it really is about it's about eating well, sleeping well, and getting regular exercise. It is that holistic approach,
mm,
with a view ultimately, from my point of view, to reduce pain, and
mm,
as you touched on, to reduce inflammation as much as possible.
mm,
At a evolutionary sort of level, if you are stressed, if your body is stressed, if it's in pain, if it's in a constant pro-inflammatory state, it's not going to want to do this really big energy dependent thing of growing a baby. Yeah. So we got to get that under control often before we can look at other things. Yes, and we can overcome low levels of inflammation, but chronic constant stress levels of pain and infertility, we really want to try and get that from a holistic approach to improve our natural chances of fertility. Absolutely. Absolutely.
yeah, yeah. So, last question here. Are there any exciting breakthrough that you observe in terms of in endometriosis, in terms of like diagnostic tools or treatments that you see in the field?
So we talked about ultrasound scan diagnosis of
Yeah.
endometriosis. That's a big area there. I think overall the education around GPs of allied health and ultimately our patients, it is at a level that we've never seen before, which is really 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 fantastic. And along with that is better acknowledgement and better push, not only from a medical point of view, but also from a political point of view. So the newest news recently
Yeah.
is we've had some new medications that have
Yeah.
been TGA approved, something called Reequo. We have had several new medications that have gone on to the PBS. And a recent announcement just last week about Yaz and Yasmin, as well as some menopausal medications that are going on the PBS, and some new endometriosis clinics that have been promised to be funded by the federal government. Those are all very, very exciting things that ultimately increase our awareness, increase our education, and increase the impacts not only just on pain, but from a fertility point of view, so that our women can then look at, all right, well, hey, this is what I have. What am I going to do about things? And again, not necessarily that all of those things that are available is going to fit everybody, but having those options available, whether it's fertility preservation or thinking about children sooner rather than later, I think those are all very, very important. And I really feel like the tide is changing from that point of view. And that's very exciting. It's very exciting.
Mm. Well, this has been such an eye-opening conversation, Dr. Albert. Now, any final advice for our audience here who might be suspecting they have endo, but not sure what is the next step?
Yeah. I think my advice to you is listen to your body. You know your body better than anybody, okay? And really, you need to advocate for yourself because nobody is going to be a better advocate for you than you. Yeah. Find allies, find GPs that are are educated and comfortable to talk to you about this stuff. And ultimately, hey, put your foot down if you have to, but to advocate and say, hey, this is where I think this is needing to go, or this is what I think I have. And we go from there. Absolutely.
Oh, thank you so much. And I know so many women are going to benefit from this episode. And thank you once again for sharing your expertise, Dr. Albert. Now, could you please share where people can connect further with you?
Yeah, this has been really fun, and it's just gone through like a lightning round here. But so I think you've got some details for everybody in terms of my Instagram handle.
Yeah,
My rooms are in Spring Hill in
yeah,
Brisbane. Just keeping in mind that again, Instagram is a great platform for us to connect, but not really a great platform for really proper,
yeah,
individualized, personalized, nuanced medical care. So
yeah.
if you do have care concerns,
Mm.
please see your GP, get a referral in. Very happy to catch up at any point.
Yeah, of course, that's a great reminder. Now, surely attach all Dr. Albert's practice detail in the description box below. And as usual, if you find this helpful, don't forget to subscribe, like our channel, and even better, to share with someone else that you know they're going to benefit from this episode. Now, thank you so much, everyone, from watching, and we will see you next time in the next episode. Bye for now.
Thank you.